An experimental surgery offered a French woman a second chance at life. Here's what happened next. In 2005, while experiencing depression, Isabella Denois overdosed on sleeping pills and passed out. Although the pills did not kill Denois, the incident did land her in the hospital with horrific injuries. While she was out cold, Denois' pet dog destroyed a chunk of her face, leaving her skull exposed after chewing off her mouth and nose. Denois awoke surrounded by her own blood. She only realized what had happened after she went to light a cigarette and could not hold it in her mouth. She was left with what she referred to as the face of a monster. But Denois was offered an unexpected lifeline, radical surgery that had never been attempted before. After French authorities granted them permission, French surgeons gave Denois a partial face transplant, the first in history. The surgery was groundbreaking and has been attempted many times since. However, the psychological impact of the experimental surgery would mark Denois for the rest of her life, and the effects of the medicines on Denois' body would eventually cause her death.
In a quiet, unassuming sort of way, Isabelle Denois made history.
Plastic surgery, including facial reconstruction, has been around for centuries, but traditionally, a patient's own skin and tissue are used to rebuild damaged facial features. Skin grafts, for example, were invented thousands of years ago in ancient India. By World War I, the need for plastic surgery due to the use of modern weaponry led to major improvements in these types of procedures. By the early 2000s, ordinary skin grafts had become quite sophisticated, which has led many people to question why doctors carried out a face transplant on Isabelle Denois in the first place. When doctors opted to use someone else's face for the surgery, they ran a high risk that the body would reject the transplant. Denois was warned prior to the dangerous surgery that there was only a 33% chance it would actually work. The face transplant procedure was carried out in a hurry, with limited discussion due to doctors' fears about scarring should they delay. According to the BBC, after 15 hours, the operation was completed and deemed a success. When she caught sight of her new face in the mirror, Denois, who was initially unable to speak, passed her doctors a note that simply said, "Thank you." After the operation, Denois looked almost normal, and she told reporters that she was hugely grateful for the surgery. She quickly gained control of the muscles in her new face, learning to eat and speak again after practicing in front of a mirror. Denois later shared her experiences with a biographer in a book entitled Isabelle's Kiss. In the aftermath of the operation, some people voiced their concerns that the procedure was unethical, arguing that Denois was clearly psychologically unwell and was therefore not an ideal candidate. The doctors involved responded that Denois' case was so bad that it warranted radical treatment. However, the face transplant ultimately had some eerie consequences for the patient. Denois reported that she initially felt deeply unsettled when looking at her own face in the mirror after the accident. She told the BBC, "When I look in the mirror, I see a mixture of the two of us. The donor is always with me." The donor, like Denois, had also attempted suicide. After hanging herself, the woman was declared brain dead, and her family gave the hospital permission to use her face for Denois' operation. The surreal situation left Denois with a profound sense of connection with the donor. Denois remarked in interviews that she thought about her frequently, saying in one, "When I feel down or depressed, I look at myself in the mirror again and think of her, and I tell myself I'm not allowed to give up. She gives me hope."
I want to restart a professional career.
According to the Journal of the History of Medicine and Allied Sciences, news about Isabelle Denois' surgery was unexpectedly leaked by the British press and led to a whirlwind of unwanted media publicity. She was laughed at by children in the street, and she received a great deal of unwanted attention that she struggled to deal with. Denois would eventually pull through and learn to accept her new face with courage, but she still had to deal with medical complications. She was subjected to endless rounds of immunosuppressant drugs and injections to prevent her body from rejecting the transplant. Following the surgery, Denois suffered from kidney failure and a number of infections, and she started to lose control of her lips in the lead up to her death. Ultimately, the impact of the immunosuppressants on her body caused Denois to contract 2 different forms of cancer. She died at age 49 in 2016. The hospital that performed Denois' surgery released a statement after her death, in which they stated that even with the very best immunotherapies, most patients suffer complications from skin transplants. The incredible difference Denois' surgery made to her quality of life for a brief time has encouraged doctors to keep trying. Face transplants are still rare, but some progress has been made since Denois' surgery. The first full face transplant took place in 2010 in Barcelona, Spain. The patient had his jaw, cheekbones, nose, and even his eyelids replaced after shooting himself in the head. The first American patient, Connie Culp, regained her ability to talk and smell in 2008 after being shot by her husband.
That's what I said. When I woke up from that surgery, it's 2009. Everything's going to be great from here on out.
As of 2021, almost 50 face transplants have been attempted in total, with varying degrees of success. Doctors often struggle to find appropriate donors for the surgery, which has impeded the progress of this procedure. For a transplant to work, donors must be of the same blood type, have a similar skin tone, and be of a similar age. Serious moral and clinical concerns about the surgery also continued to trouble doctors, but the miraculous benefits of the surgery give many hope for a brighter future. If you or someone you know needs help with mental health, please contact the Crisis Text Line by texting HOME to 741-741. Call the National Alliance on Mental Illness Helpline at 1-800-950-NAMI 6264 or visit the National Institute of Mental Health website.